This is a TalkStation original podcast.
Welcome back to another episode of The Senior Moment with myself, Ryan Kelly, and unfortunately Lynn is feeling a little under the weather today, so she will not be joining us, but we do have Angela Pridgeon joining us. Angela is a representative from the East Carolina Council Area Agency on Aging. Did I get that right?
Eastern.
Eastern.
Carolina.
Oh,
Yes.
I was so close. I was so focused on trying to get the AA. So, Angela, can you tell us a little bit about what is the Area Agency on Aging? I coming from Maine, I'd never heard of it. I didn't know what y'all were, and you showed up at Carteret Landing one day, and I just was like, who are these? Who are these people?
Sure. Our area agencies on aging are in every state across the country. For us, our area agency on aging, we have our programs such as the Ombudsman Program, the Family Caregiver Program, but we do channel money from the state through to our providers in the county. So that's our senior centers, DSSs. So making sure that the money goes to these providers so they can provide the services in each county that we serve. And we serve 9 counties, and I'll go through the list, try not to miss them. Carteret, Craven, Duplin, Greene, Lenoir, Jones, Pamlico, Wayne, and Onslow County.
Now, you were telling me earlier that a lot of what the Area Agency on Aging does for Carteret County is working with our local senior center, and trying to help in funding and finding grants, and the money goes from the government to the senior center to be able to provide a lot of their programs.
Yes.
Now, the specific area that you're an expert in is the Ombudsman Program, and that's how I had the opportunity to meet you. What is the Ombudsman Program, and can you fill us in a little bit about it?
Sure. I'll start with Ombudsman. It is a Swedish word for advocate. So it is a program that is designed, it's actually under the Older Americans Act. It's federal law that every state in the country have an ombudsman program, and that is to advocate for residents in our nursing homes and our adult care homes, focusing on their rights and providing quality care.
Now, you had told me earlier as well that depending upon what state you're in, they have different roles. But this is the area that in North Carolina, this is where we specialize is in the senior care in different communities, like you said, long-term care, assisted living, nursing home, memory care. So when the ombudsmen come into these communities, what is it that they're doing?
Sure. We are, our main focus is resident rights. So to make sure that residents know what their rights are, know that if they have any concerns, that they have somebody to advocate. So we are the voice for the residents. They're our most vulnerable population, so we want to make sure that everybody has a right to quality care, quality services, the right to be treated with respect and dignity, the right to still make choices for themselves. So when we come into a facility, we are visiting with residents, interviewing them, see if they have any concerns or complaints. If they do, for our program, we have to have consent to use their name. Our focus is confidentiality, so unless we have written consent, then we cannot advocate for that resident using their name. So they can certainly make a complaint. We try to handle it anonymously, addressing certain things. For example, if a resident says, hey, there's not enough staff, I'm not getting the care I need, but please don't tell anybody I told you. We're interviewing a group of residents to see if anybody has the same issues. If there's issues such as call bells not being answered timely, showers not being given, that can kind of signal maybe there is a staffing issue. But if they give us our name, we can get specifically with that resident. We can view their medical records with their consent, look to see if there's any care issues that need to be addressed, any changes in their care plan that can improve. For example, a resident is given showers in the morning, but they prefer them at night. We can meet with the staff and say, hey, this is their preference, and have that care plan changed to showers in the evening. Because everybody has a preference, whether it's food, whether it's when they wake up, shower times. We just want to make sure everybody has that right to make that choice and decision.
Now, I mean, whenever you've come to Carteret Landing, we've always had a great relationship and being able to work back and forth. As an ombudsman, you're not an enforcement agency, correct?
Right, correct. Yeah, we are not regulatory, but we are mediators. So we are required by law, if we cannot resolve something within the facility within our realm, then we are required to turn it over to a regulatory agency. So we do our best to build relationships with our administrators, with staff, so we can work together, because really we're all there to try to support the resident and provide the care that they need. So that's our goal, is building relationships so we can work as a team.
And I know that's how Carteret Landing has always felt, is that
Yes.
you're part of our team, and when we're working with a resident and having some concerns with the resident, we've reached out to be able to utilize the Ombudsman services as mediators, and it's worked out really, really well. So, you mentioned that when we come in. Now, I know that there are 2 professionals, but overall this is a volunteer program. Is that right?
Yeah, there's two of us, myself and Lauren Latshaw. We cover the 9-county area, so we have about 100 facilities that we cover between the 2 of us. So each county also in the state of North Carolina has a volunteer program. They're called the Community Advisory Committee. And so we have those in Carteret. We have an amazing group in Carteret. Our nursing home committee is full, and we're working on that with our adult care committee. But they're volunteers that are trained. They go through orientation hours the same as us, 36 hours of orientation training, and then are designated by the state of North Carolina and appointed by our local county commissioners to serve on the board. And they're visiting quarterly as well, interviewing residents to see if they can address any concerns while they're in the building.
Now, how do they become a volunteer ombudsman? What's the process that they go through to be able to do that?
Certainly, they can contact our agency, the Area Agency on Aging. They can contact the county commissioners to let us know that they're interested. So we go through kind of make sure that there's no conflict of interest. Such as you can't have a family member that is working in that particular facility, the long-term, whether it's a nursing home or assisted living, depending on what committee that you serve on, that you don't have family working in the building or family as a resident. So right to start with. But those are some things that disqualify you. But other than that, just being willing to serve, to just take the time to be with residents.
And do they have to get approved by the county commissioners to be able to do it, or as long as they're willing to volunteer, it's just and don't have any of those conflicts, they can jump on in?
Well, they have to go through the orientation process. So through my office, Lauren and I will provide facility orientation training, a classroom training, give them some information to kind of work on their own. And then the state ombudsman office will do an online training. And once they are completed with all those areas, then they are designated as a volunteer. And then we submit their names to the county commissioners, and they vote to appoint them to serve.
Okay. Now, I know... I at least hope, because my mom lives in Wake County, that we have at least one person listening that's outside of Carteret County, so outside of the jurisdiction of your Area Agency on Aging. How would somebody become, or how do the people learn about the Ombudsman program outside of Carteret County?
Sure. Well, we try to do as much advertising as we can, just kind of education. We speak to various groups in the community, whether it's church groups, Civitan, our local senior centers, trying to get the word out. We put the word out on Facebook, articles in newspapers, and just kind of word of mouth. But also the Ombudsman program, they are required, nursing homes and adult care homes are required to have our posters in their building. So any facility that you go into, you should be able to find a poster that has your Bill of Rights, and then it'll have my name or Lauren's name at the bottom, or depending on what county, it'll have the ombudsman in that county, their name and contact number, so they can reach out and speak to them for
So really, that's
assistance.
probably the easiest way if you're not here in this county and listening to the show to be able to reach out to you. But if you're in another county, just go to your local nursing home and find the poster and then be able to reach out to the local ombudsman and learn about the local program there.
Absolutely. It's so surprising. People don't know, even residents in long-term care, but you don't know what a service is until you really need it. When you start having concerns, don't know who to go to, and then you start doing your research. Because when someone's admitted to a facility, they're getting a lot of paperwork, and our information is included, but it's just in a big packet of information. And so until you need us, sometimes you just don't know. So that's why it's so important to get the word out that we are there for advocating for your loved ones. But also, if you're looking at placement, you're looking at trying to place your loved one in a long-term care facility or yourself, and looking towards the future. We want to provide the information and support of what to look for, what questions to ask, what the costs are, what the coverage with insurance is. So we support the families in making an informed decision. You don't want to be at the hospital after having your hip broke and the discharge planner says, okay, you're going to a nursing home today. Which one do you want? That's a stressful situation to know. So it's so important to know ahead of time what's available in your area when that time is needed, that you may have to make a choice of long-term care.
Hi, this is Lynn Schultz at Carteret Landing. We invite you to visit our beautiful assisted living community. Carteret Landing pairs exceptional, compassionate senior care with the stylings of a resort. Our beautifully appointed suites, common areas, and bright and engaging memory care neighborhood can provide you or your loved one with the quality living they deserve. Carteret Landing is in Morehead City, right behind the Friendly Market. Come by and see us today or call for your personal tour at 252-773-0980.
Hi, this is January Brown with Eastern Carolina Council, Area Agency on Aging, and you're listening to Senior Moment.
Now, before the break, we were talking about trying to be prepared before needing to go into a community, and how the Ombudsman program can be a resource and help in making those decisions and telling people what to look for and what questions to ask. What are some of those things that you discuss with them when they do reach out to you?
Gosh, I'm thinking about, right to start with, things that you may need to know when you're looking at long-term care, what's needed. Seeing your doctor, first of all, and finding out what level of care either yourself or your family member may need. So they have to fill out an FL2 form, and that gives them an idea of what kind of level, what care is needed. So you understand whether they need assisted living, a nursing home, a memory care unit. So understanding, having that conversation with the doctor to know what level of care you're at. TB test to make sure that you're safe when you're going in the community. But understanding the difference in the long-term care. Our nursing homes are your higher level of care. So they have your physical therapy, your occupational therapy, speech, your RNs, your LPNs, it is skilled. It's the medical model, where your assisted living is your social model. So just like it sounds, assistance with living. So just needing some help, basic needs with your feeding, dressing, bathing things. So assistance. And just understanding, so many times I get calls of they don't know exactly what they need. They know it's long-term care, but asking those questions of what level does my loved one need? And that starts with a conversation with the physician. Things that we look at when you start to look at the long-term care is what can I afford? What is the income? There are income limits for getting special assistance, for getting Medicaid. So for assisted living, if you're below the income limit, and it's new for 2026, it's 14 something now. But if you're under that income limit, you can apply for special assistance, and that helps you pay for the cost of the assisted living. If you're over that amount, that's private pay, and those costs can add up very quickly. For our skilled nursing, and it's a lot of times it's easier to qualify for skilled nursing. The income limit is higher, and it's not just that blanket cutoff like it is with special assistance. So, you would apply for those through the Department of Social Services to see where you're at. If you have to go through a spend down process, you can't have any more than $2,000 of assets in your bank account. Can't have extra property. So those are things that you may need to spend down. But first, always find out what the income limit is, because if you spend down first and find out that no matter, you spend everything and you still don't qualify. So it's important to understand what that income limit is. And if they need a memory care, people with dementia, they may be diagnosed with dementia and may not need memory care. You need memory care when you are an elopement risk, when it's not safe for you. You walk out the door and you don't know where you're at and how to get back in. So a memory care is for individuals who need a safety protection with that disease process. And so you can have dementia and be in regular assisted living and a skilled nursing, but just not have that elopement risk. So understanding and communication with the doctor is so very important.
Jumping back to the financial component for a second, one of the questions that we often get asked is, I'm a vet. Is there anything is there any way to get help by being a vet? Is that something that the Ombudsman program can help with, or is it better for the people to go to the VA and try to work through the VA to get any benefits that are available?
I would say go through the VA. Because that is their baby. We do the referrals, so we wouldn't handle the Medicaid cases. They would go to DSS. So any VA benefits, go to the VA. Try to find out everything that you can possibly qualify for. So that's a very important thing. People may not know that they have benefits. So it's so important to have that communication with the VA if they've served in the military.
But it sounds like you all can be a good resource for people to reach out and ask those questions.
Yes.
And you can help and direct them to the right spot to find out what their benefits might be and who might be able to help them. And then, of course, long-term care insurance would be the final option. But I know none of us really deal with the long-term care insurance.
Yes.
That's the carrier themselves to reach out to. So
absolutely not touching that one. But we are available, for individuals to come to our office, or we can go to them, sit down and talk about options. We can go to their home. We can meet them locally in their community, just to sit down and look and go through, hey, this is where I'm at. This is what I'm thinking in the future, or this is where my loved one's at. We can provide them with the list of facilities in our area, outside of our area. Encouraging them to look at state surveys, specifically for nursing homes, to see what problems the nursing homes may have had, what their star rating is. Same thing for assisted living, just to know any issues that may have had. Now, we can't give them our opinion, of course, but one thing we do share is what we have experienced. So I can say, hey, at Carteret Landing, I've worked really well with Ryan and Lynn, and so I can tell you anytime that I've had issues, I've been able to work with them. And I think that's important for people to know, because you're going to have issues everywhere. There's human beings working with you. It
right,
happens.
Absolutely.
But it's how you handle the process is what's important and what matters, and that those issues are addressed when you do have concerns, and that's what we focus on.
So visiting, let's get to when a person wants to go and tour a community, and you visit over 100 about every quarter.
Yes.
So personally, I think when you walk into a community, you get a really good sense of how it's going to be just by walking in. But what do you tell people to look at when they're going in and touring the communities?
Certainly. I mean, as you walk in, pay attention to the smell. You should not smell anything. You should take a breath on the outside, walk in, and the same thing on the inside. It should not have the smell of urine throughout the building. And I remember that's really kind of how I've had a passion for this as a child. I remember going to a nursing home and the smell of urine and thought, I never want anybody to experience that. So just paying attention, using your senses, what you see, is there commotion? Do people look relaxed? Do you see smiling faces? Do you see call bells going off and no one responding, or people yelling out for help in the hallways? Smell, touch. Does it feel comfortable? Does it feel hurried? What are you greeted? I love when I go to a facility and staff stop me and say, hey, can I help you? They should ask. They should acknowledge when people are in the building. I think those are things to look for. And just weekends are a great time to get a really bird's eye view of what's going on in the building, because sometimes, management is gone, and if you have a strong staff, they're doing well on the weekends. And if there's some areas that need improvement, you may see it on the weekends. After dinner is a great time to visit. Lunchtime is a great time to visit also.
I always like to say, listen for laughter.
Yes.
If you hear people laughing, then you're in a good place. Now, on the opposite end of this, of finding the good places, we want to talk a little bit. I know this is an important and passionate subject for you. This is Elder Abuse Awareness Month, and so as we're wrapping up the show, I know we've got a couple minutes left. I want to let you talk a little bit about that.
Sure. June 15th is World Elder Abuse Awareness Day. North Carolina recognizes Elder Abuse Awareness Month, Mother's Day through Father's Day. I'm wearing purple today for Elder Abuse Awareness, but we want to get out the word that we're not standing for elder abuse, and that if anyone suspects someone is abused, neglected, exploited, that they contact your local Department of Social Services, your Adult Protective Service, and report that. You don't have to prove it. If you suspect it, report it. That is our duty, is to make sure that we are protecting our older adults. So things that we can do is pay attention to our older adults in our church, in our community. If they have needs, if they're doing without, if your neighbor's grass is knee high and mail falling out the mailbox, something's going on. Maybe they need help, and just letting somebody know that there's concerns.
Now, a lot of times when I think of abuse, I think of actual physical abuse, but there are other types of abuse. Can you talk a little bit about, the verbal abuse or financial abuse, and just address that a little bit?
Absolutely. We know physical, hitting, kicking, slapping, those kind of things that you can see, the bruises that you can see. But what we don't see is with emotional abuse, berating an individual, isolating someone from friends and family, making them feel bad about themselves, that they are a bother. Those are things that are just cruel. You don't see them, but it is so detrimental to someone that's older. Exploitation, whether it's financial exploitation, taking their money, sexual exploitation, exploiting them. One of the things, unfortunately, that we see a lot in long-term care is financial exploitation, but it's really hard to prosecute and report. The money should always follow the person. If they go to a facility, their money should follow them. It should not continue to pay for children's bills. It should follow that adult.
So if there are any concerns, a good place to start would be to reach out to the local ombudsman, and they'd be able to direct the person to where they can report it to, or help in figuring out exactly what to do.
Absolutely.
So
always report.
Always report. So one more time as we wrap the show up, this is a volunteer program for the most part, and if somebody wants to become a volunteer, they should do what?
Call me. Call Eastern Carolina Council Area Agency on Aging, 252-638-3185.
Angela, thank you very much for coming on the show today. I really appreciate it. I promise before this is all said and done, I'll get the name right.
Thank you.
Have a great afternoon.
Thank you.